Welcome to the Surviving to Thriving podcast with Jim Squire. I'm a registered psychotherapist here in Toronto, Canada, and this is actually my 10th episode. I'm excited you're here with us, and the topic for this particular episode is anxiety. Now, this is one that a number of people have requested, and I'm not surprised because in my experience, it is the most common issue that's leading people to therapy. There are a lot of people that have difficulty with anxiety that I don't think identify it as anxiety. It's more or less discomfort that they experience. So anyways, I'm just going to just jump right in here. Anxiety is, I think, easiest to understand as our body's alarm system. And really without it, we wouldn't do very well. Some people would say that we wouldn't survive very long. I think that's probably true. It alerts us to danger. It alerts us to negative outcomes, threats. The problem is that it often misunderstands or misperceives. This is not typically a situation where we are experiencing a life or death situation. It's anxiety can be triggered by a number of just everyday situations like failure, being viewed negatively, rejected, things like that, which are obviously uncomfortable but not life-threatening. So anxiety is basically a perception of a negative outcome or threat, which could be real or imagined. And in some respects, anxiety or worrying is simply understood, I think, best from how I look at it, as you just don't feel safe about something that's happening in the future. It could be 10 minutes from now. It could be, 10 years from now. Anxiety is always about the future. And of course, along with what happens is a person who's anxious is predicting a negative outcome, which is exaggerated typically. And when that happens, there's a term we use called catastrophizing, which is basically, as I describe it, take a small bit of information and draw a huge conclusion, which is negative. Now, of course, if I draw a large conclusion to something and it was positive, I wouldn't be anxious. I'd be excited and thrilled because this wonderful thing is going to happen. So it's important and kind of obvious, I guess, to state that it's always about something negative, something harmful, some perceived difficulty, challenge, something to that effect. And I'll get into it in a little bit later why that happens, because there's very specific reasons why we are anxious. I want to start off with a little story about when my earliest clear memory of anxiety. And I don't think I called it anxiety, but I was one of those kids that was referred to as the shy kid. And I used to hate that word. It's thankfully not used very much anymore. And so I guess it was like grade 7 or 8, junior high, and we were having these dances. And I don't know if it's like that now, but girls are on one side, boys are on the other side. And, the expectation was you would ask a girl to dance. The problem was you had to walk across the dance floor in view of everyone to do it. And the idea of doing that, and then, of course, being rejected, was just too overwhelming for me. I remember so many times I tried to make the move, and I felt like my feet were glued to the floor. So I even developed a little strategy that I thought would help, which it didn't, which was counting to 3. 1, 2, 3, go. 1, 2, 3, go. And of course, I never moved. And I don't think there was probably, I don't know how many dances, a few of them, 3 or 4 at least. I never asked anyone to dance. It was just too overwhelming for me. And that's my first really vivid memory of anxiety. And I remember how upset I was with myself too, that I just couldn't do something that on one level I felt was very simple. Just ask a girl to dance. But just the fear and the anxiety associated with that rejection, potential rejection, And I guess the humiliation of everyone seeing the rejection was incredibly powerful and kept me frozen. So I thought that would be a fun way to start our discussion of anxiety. So when we talk about anxiety, it's important to understand that there are a lot of physiological or bodily sort of reactions that happen with anxiety that sometimes are not always associated with anxiety. Things like nausea, stomach pain, headache, insomnia, weakness or fatigue, rapid breathing, shortness of breath, increased heart rate, sweating. A lot of people get sweaty palms. Some people just sweat profusely, trembling, shaking, muscle tension or pain. Just there's, to name a few of them, the most common ones. I remember years ago working with a client who basically would wake up, and the moment he became kind of awake, his anxiety would kick in, and he would actually, start vomiting. That's how anxious he was all the time. So it's certainly not something that's easy to cope with for people that suffer with it. It's exhausting, and they really suffer. I mean, I don't think there's any other word to describe it that describes it well other than suffering. People are suffering with anxiety. But there are some fairly effective treatments, and I feel they're effective, and I have had a lot of success with them with clients, and I'll get into them as we progress. So one of the things about anxiety that's unfortunate is that people intuitively do the worst thing they could do with anxiety, which is to avoid stuff that triggers them. And I know in the moment, they're trying to find some relief from the way they feel, so they move away from the thing or abandon the attempt to, say, go to a certain place or do something. Say I'm going to talk to my boss and ask for a raise, and I feel really anxious, so I tell myself I'll do it next month. And so, of course, once I do that, I feel some relief. The problem is that if we do this frequently, what it does is it kind of trains us, kind of programs our belief system that we can't do certain things. If I avoid going on the highway for 6 months because I'm too anxious to drive on the highway, I'm going to get to a point where I believe that I can't drive on the highway. And so, of course, my anxiety, if I ever have to go on drive on the highway or whatever it is you're doing, is going to be much worse. And unfortunately, I see this a lot with young people and parents who mean well, want to save their young person from those anxious feelings. So they tell them you don't have to do this, or you don't have to do that, or you don't have to go to school. You can be homeschooled or something like that. In an effort to be kind and helpful, they actually end up contributing to the anxiety being much worse. So, of course, then the question people have is, well, what are we supposed to do? Well, what we want people to do is, we don't want people to be completely overwhelmed, but we want them to start to move towards things that they're avoiding slowly with some coping skills, with some deep breathing, with some strategies we use to kind of make it easier. And in fact, when I go back to the analogy of the highway, I've worked with people that are anxious about driving on the highway, and I will encourage them to go on the highway, like where I live. You can get on and off the highway. I think it's not even a kilometer. So get on, do some deep breathing, drive for a kilometer, get off the next day or the next time, do a couple kilometers, do 3, and then gradually over time you build up. I don't get somebody to go on the highway and drive across the whole city, and then they get completely overwhelmed, and then it makes it that much harder. So we have to be careful But what I'm trying to get at here is we do want people to move towards the anxiety with coping skills, with things like deep breathing and some of the thinking strategies that we use. Mindfulness is wonderful for helping you cope with anxiety, meditation, things like that. So I'm just going to go into a bit now about how the different sort of ways, at least. It's not going to be exhaustive, but there's some different ways that we use, different strategies we use different models we use to work with anxiety. And one of the main ones is cognitive behavioral therapy. Now, the one I used to use more often, it's probably a balance right now. So we have what we call the second wave of CBT, which which has been around for quite a while, would involve reframing, taking a look at the underlying beliefs associated with the anxiety, using things like thought records to track when the trigger happened, what the irrational thoughts were, how elevated the anxiety was, and then reframe the thought. If I, for example, my boss is upset or my company is restructuring and I think, oh my gosh, I'm going to get fired. That's kind of an exaggerated, irrational thought. So one of the ways to kind of manage that would be to reframe it that we don't have any evidence for that, or we don't know what's going to happen. There's no reason to get anxious over an outcome that we don't have any evidence that's going to happen. So that's a bit how I typically started working, and still do to some degree work with anxiety. And the other way is what we call is part of the third wave, which would be approaches like ACT or mindfulness, which actually do the opposite of not challenging the thoughts, but learning to distance yourself from the thought. Now, that one's a bit trickier for people initially to kind of grasp. So especially if you're struggling a lot with anxiety, you think you're going to just not engage with the anxious thought. It seems kind of overwhelming. How would I do that? Well, part of the way the third wave works well, and I teach mindfulness and I have a mindfulness course, so it's very effective with anxiety, but we have to, through things like meditation and through certain exercises and practices, learn how to distance ourselves from our anxiety, distance ourselves from our thoughts and emotions, create some space where we can observe them without being in them. And so, for example, somebody might be like, oh my gosh, I'm so anxious. Whereas a person that had practiced some mindfulness might think, I'm feeling some anxiety in my body. And although it's a very subtle difference, it's a huge difference in terms of how the person works through that. So those are a couple that I principally use. I typically want people that have anxiety to do something like meditation or deep breathing exercise every day to kind of reduce the tension in their nervous system so that there's overall their anxiety would be more manageable. Now, we have to also, of course, manage the things that are triggering the anxiety, or at least when we approach it from the second wave, the classic sort of CBT perspective, we would then sort of, manage those triggers better. So I'm just going to touch on that a bit because in all of them, it's the same. I was going to say that, typically in the classic CBT, the second wave, we would challenge the beliefs. In mindfulness, we wouldn't challenge the beliefs, but the beliefs are still there and the beliefs are still the problem. And I don't think the average person actually thinks about this. And so one of the ways we can actually get to a place where people who don't have much anxiety, rather than just managing symptoms, is we restructure their belief system. So, for example, things like confidence, which confidence is rooted in a belief. So when you think about high levels and low levels of confidence in certain areas, they're usually accompanied with anxiety. I mean, I should say that the low confidence would be accompanied by anxiety. So, for example, if I'm not competent, I don't have confidence in myself as a therapist, I'd probably be fairly anxious at times doing some of the things I'm doing because of that. Whereas if I had a high level of confidence, I would not have anxiety. So I sometimes, we're in a podcast, so I can't really demonstrate, but I usually kind of hold my hands together and move them in opposite directions. And it sort of demonstrates, as we increase confidence, anxiety goes down. As anxiety goes up, confidence is usually lower. And so explaining it that way, beliefs are basically the reason for the confidence. If I feel super confident, if I feel very little confidence, that is a belief in my ability to do something, to handle something, to cope with something, etc. So we structure the beliefs with anxiety for this very reason, so that people have a more accurate, because typically our beliefs are not accurate, more accurate way of looking at their anxiety. For example, if I have very little confidence in my work ability, I will be struggling with a lot of anxiety at work. And if I say, I guess, now I should back up a little. Now, the other thing with beliefs too is we have core beliefs around large groupings, and they can end up becoming negative. And if they're negative, we can have things like feeling unlovable, unlikable, feeling helpless, feeling like worthless. These are sort of some common core beliefs that are negative that cause people tremendous suffering. For example, if I'm in a relationship and I have a core belief that I'm unlovable, the person I'm with could tell me all day long they love me, and it's not going to do much because in my core belief, it's that I feel that I'm unlovable. So without understanding that, some people don't understand that. Without understanding that, I would, in a situation like that, be chronically uncomfortable and anxious and insecure, feeling my partner might leave me. And it would make sense because I think I'm completely unlovable. So, and that's typically what happens. If I have a belief that I'm unlovable or not that lovable or don't have much to offer someone, etc., of course I'm going to be insecure in a relationship. I'm going to think that this person's going to very easily find either someone else or just wake up one day and realize, look at me the way I look at myself and leave. So these are just some examples of ways that anxiety can really create a lot of suffering for people. I don't think typically, as I said, people think of the beliefs as something to do with anxiety, but it has a lot to do with it. And of course, when we change these beliefs, it makes a huge difference. Now, somebody who has a core belief around being helpless is going to have anxiety in almost like every area. They're not going to feel safe in almost everything they're doing. They're going to feel that perhaps they're not going to have confidence in their health. They're not going to have confidence in a lot of things going on in their life. They might feel that they have very little control in their life. And so that's a very common one. I find that often people who have sort of a lot of anxiety around health issues, health fear sometimes is referred to, it can be traced down to a sort of core belief of helplessness. So some of the other things that can go along with anxiety, which are kind of in the same family, are things like panic attacks. So panic attack is kind of like an extreme, where you're like an extreme sort of experience of anxiety, but your body's kind of thrown into fight or flight. Your nervous system is thrown into this extreme fight or flight survival panic mode. And that's why you feel that way. That's why you're overwhelmed. That's why people have all these kind of physical sensations. You know, their body is ramping up for either fight or flight or freeze. because of a threat. So the blood is being taken from your organs and sent to your extremities. People feel like they can't breathe. They feel lightheaded. They feel numb in their hands and feet. These are all because of the way the body's organizing itself for a perceived threat. Now, unfortunately, one of the problems with panic attacks is that if you identify that you're going to have one, you're almost guaranteed to have one. For example, if I'm on the subway and I start feeling like I might have a panic attack and the subway is full of people and I can't get out, and I go, oh my gosh, I'm going to have a panic attack. Well, it's very likely that kind of experience and that way of responding is going to make me completely overwhelmed, and I'll have a panic attack. So that one, we hear that term a lot. It's a lot of times people are having panic attacks. They're not managing their stress well, and their nervous system is kind of in this extreme heightened state, or their body's in this sort of stress response all the time. And a lot of these sort of ways the ways we tackle it are actually to reduce a lot of the stress in your life, move towards having more time to relax. Sometimes people take time off, make some minor lifestyle changes. But even understanding why it's happening can help people realize that in most cases, it's triggered by your system perceiving something that's not true. I mean, you're not in a life or death situation, but it's misunderstood the situation to be that. So one of the things I want to talk about too is goes along with this is understanding that, like most of the thoughts you have, about 90% of the thoughts you had today, you had yesterday. And a lot of the thoughts you're having are just complete chatter nonsense. Your brain is just kind of going over this and going over that. And I don't think a lot of people necessarily scrutinize and look at their thoughts. Now, one of the things that's great about mindfulness is you can create distance from your thoughts and start to observe your thoughts. And of course, even with the CBT, the classic CBT, where we do thought records, you're actually writing out sort of what triggers you and what thoughts you're having. And you can start to see how the brain is operating, where there's just this exaggerated, often irrational, ridiculous response to things. And I know with mindfulness, when you can create space from your thoughts and just kind of really observe them, you realize, oh my gosh, there's just all this kind of like nonsensical chatter going on all the time. So the important thing about that, and the reason I'm mentioning it, is that if we stop looking at our thoughts as being credible, if we start looking at our thoughts as a lot of it is just meaningless nonsense, then we stop creating so much, like attributing so much importance to them. I start to look at it more as kind of this, kind of just a response to things that's really not very, doesn't make a lot of sense in a sense. So it's one of the strategies we do is, of course, reduce this credibility to our thoughts, start to scrutinize our thoughts more. People learn about things like cognitive distortions, which catastrophizing is, I mentioned earlier. So these are thinking errors that happen that are very they're good to be aware of, because we can realize when I'm catastrophizing, I'm minimizing or maximizing, I'm using emotional reasoning or whatever it is. And so there's a number of them, and you can just Google cognitive distortions, they'll all come up for you. It's often helpful to have that kind of like a handout or something to look at. I typically give them to my clients so they can sort of, understand and be able to call it out when it's happening. Oh, I'm doing this or I'm doing that. And understand it as thinking errors, as ineffective ways of thinking. So in that, that perspective, hopefully for most people, reduces the credibility they give to those thoughts. So One of the other things that comes up with anxiety is, of course, it's typically thought of more as fears, but phobias. So these can be very specific areas like spiders or flying are quite popular. As I mentioned earlier, somebody might have trouble with driving on the highway, but some people are afraid of heights, afraid of dogs, these kind of things. So, and they're not that, typically it's not that difficult to work through. Now, flying can be more challenging on some level because most people don't fly that often. So it makes it difficult to get really good and comfortable flying when you can't, typically people don't go on a plane every week. So, but if someone has, say, a phobia with spiders, which is very common, we typically do what we call exposure therapy, where I would show them pictures of spiders and videos of spiders, and they would eventually get to a place where I had one client who was able to kill the spider, and that was a real victory for him, whereas typically if he saw a spider, he would just run out of the room or out of the house. So being exposed to these things repeatedly, what that does is kind of shows you that you're okay. I mean, typically if there's a spider walking around right now on my laptop, if I had a spider phobia, I'd flip out. I'd be quite upset, quite anxious, overwhelmed, but I'm really okay. It's not going to harm me. It's not, I live in Toronto, Canada, so it's not going to be a tarantula or something. Now, there are places, of course, where these wouldn't necessarily be overreactions. They could be, these spiders in different parts of the world could be very deadly. So in that case, it would make sense that you were quite anxious around them because of the threat. So anyways, so there can be a lot of different types of phobias, and almost all of them are worked through with this, what we call exposure therapy. So now the other one that comes up a lot is social anxiety. So this is typically anxiety related to, as it says, social situations. And really what it's typically about is a perceived judgment by other people. And that judgment is then considered to be negative. So they feel they're going to be rejected or embarrassed by in some way, humiliated perhaps. So we would see this a lot if someone is going to a function and they're going by themselves maybe. They don't know any of the people there. That's the key part of it, is you don't know the people. So because you don't know them, you don't have any confidence in how they will receive you and how they will experience you and whether they will judge you. So you might overly focus on what you're wearing and how you look, or as you get there and approach the place, you become overwhelmed with thoughts of like, what will they think, or what will people say, or how will I manage there, etc. Now, the thing that's interesting about social anxiety, which is kind of obvious, is if I go into a function and I don't know anyone, I might have a lot of social anxiety. But if I see those same people a few times and they seem to be friendly, nice, accepting, warm people, I won't have the social anxiety to the same degree. I might not have it at all because I'm comfortable now with these people and I don't have this anxiety around their judgment or their rejection. So that one is sometimes, social anxiety is often rooted in a core belief that is similar, a likable, we would call it sort of an unlikable core belief. So in other words, I hold this belief that typically people who meet me don't like me. I don't do well socially. I don't function well. People don't find me interesting. People don't find me enjoyable to talk to, things like that people have created beliefs around probably through experiences. And then when they go into these social situations, their anxiety is very heightened because of that. So, and it makes sense given that belief system that, one of the things I think a lot of people don't realize, because they're not really focused on themselves, and I say this to my clients all the time, when you're going into a social situation and you feel awkward and uncomfortable and you're anxious, the other person doesn't necessarily understand what's happening, but they may read you as not being interested in talking to them, not being interested in being social because you're maybe not saying anything, you look uncomfortable, etc. They don't necessarily understand that you're anxious. They might just think you don't want to talk to them. So typically people are kind of reading your energy. They may not approach you. And if they do, you may not say very much because you're so anxious. So it's one of those things that is quite challenging. But when people start to become more aware of how they're presenting themselves, it's a lot easier for them to then become a little warmer, become a little more receptive. If someone does talk to them, they, quick to exchange and talk back with them. And that's quite helpful. But there again, we have to start to become more aware of what's going on. That's what a lot of these approaches I mentioned, at least the ones that I use. Now, there are other approaches that other therapists use. I don't talk about them because I'm not that familiar with them. I would think that CBT, the second or third wave, are probably the most common ways of approaching anxiety. And so it's so there's a lot of help out there. I've actually created an online course called Conquer Anxiety, because let's face it, not everybody needs therapy. Everybody wants to go to therapy. There are some fairly simple strategies and exercises that people can do that this course goes over for them. And it's really designed for people that struggle a bit with anxiety but aren't interested in therapy. Certainly, it's not a replacement for therapy at all. It's just another way of offering something to people who, quite frankly, aren't interested in therapy and in some cases, don't need to go and spend an hour session when they can maybe do something like this course. Some people read a book and use that to help them with their anxiety. Although in this course, I do offer like Zoom teaching opportunities and Q&As, because there are specific things that come up for people that they're confused about. That's why we're approaching it that way. I also have an Embracing Mindfulness course, which is a longer sort of 8-week course that takes you through the key areas of mindfulness. And certainly after that course, you would have a much better handle on distancing yourself from your anxiety, from your thoughts, getting much more aware of what's happening with your thought patterns, etc. And certainly with the training in meditation, you've got an ability there to sort of meditate for 10 to 15 minutes, 20 minutes, whatever it is, and really kind of detach yourself from those triggering thoughts and get some calm kind of peace actually happening there. So those are two other things that I guess I'm plugging at the moment, but these are courses that are available. If you have any questions, you can email me. I think I've given a fairly good overview of anxiety. It's something that is quite common these days, but I also think there's a lot of people that have looked at their anxiety as something else. Like overthinking, for example, is rooted in anxiety. People often think, oh, I'm just an overthinker. They're not necessarily realizing the reason you're overthinking is because you don't feel safe, and your mind is looking for a way to feel safe by going over all these scenarios and going over all these kind of situations again and again and again. In some cases, not finding any sort of option that's safe for any sort of resolution. So the other thing is we call high functioning anxiety. People are typically very structured in their routine. They're making lists. They're not coping well if they're, say, late to the office or something may happen, because they're trying very hard to control their life in such a way so they don't experience anxiety, but they don't typically sometimes know that that's what it is. They're avoiding the discomfort, but they're not necessarily waking up and saying, oh gosh, my anxiety is quite bad today. They're typically just spending a lot of time making lists, planning, coordinating things. If I'm going somewhere, I might spend a lot of time planning a route to get there so that I don't run into any problems and I'm not late and I don't encounter any traffic, et cetera, et cetera. And so I'm managing my life quite tightly, which is a problem because, there's a lot that you can't control. And then, of course, you end up, if you're encountering things you can't control, if your day's gone kind of sideways on you, then you're into that anxiety. You just don't feel well. You're not coping well. You're upset. You're irritated, frustrated. All of that's going on because you're just doing whatever you can to avoid feeling anxiety. So helping people realize that and see that helps them sort of, start to cope with, like, if I'm 5 minutes late for work, maybe it's not a big deal. I don't need to be racing through traffic, almost like getting in an accident just so I'm not 5 minutes late. Maybe it's not a big deal to be late, but it's about being aware of that and realizing that I have to, it isn't a big deal if I'm 5 minutes late. But in my mind before that, I perceived that as just unacceptable. Can't do that. So those are some other ways that anxiety pops up. I do find that sometimes people have also something called an anxious attachment, which is typically rooted in experience as a child and can create all sorts of really big challenges in relationships because they may be typically somebody who's got an insecure, anxious attachment is what we would, for lack of a better term, maybe very clingy. They're clinging to the person. They're feeling quite insecure, of course, and needing a lot of reassurance and around that. And it can be really challenging in relationships because, especially if you're with a person with a secure attachment, they may feel they don't want to deal with all of this, and that there's a lot of neediness that's happening that isn't necessarily appealing to a lot of people. So hopefully that's been helpful for you. It's giving a bit of an overview. And by all means, I would love to answer any questions you may have. Send me an email, send me a message. My practice email is my name, jimsquire.counseling with 2 L's @gmail.com. So I'm happy to hear to answer any questions you may have about anything I've sort of discussed or anything else you might along the lines of psychotherapy. So I appreciate you being with me, and I hope you have a wonderful day or evening. Take care.